Do others want to weigh in on that question of forging partnerships?
When you're looking at forging public-private partnerships, there is an education aspect that needs to go on before these partnerships happen. And what I mean by that is that certain industries are very aware, and I think the pharmaceutical industries are quite aware of the acute problems within the supply chain. But when we're looking at broader, when we expand that industry sector to telecoms and we expand it to logistics providers, there needs to be a greater understanding of what is what are the demands and what are the constraints of working within the public health infrastructure and the architecture within the country. And there's a role, obviously, then to educate and to inform ministries who may be skeptical at some point, or there is some resistance to working with the private sector. And I think organizations, not just Gavi, but global organizations, actually have a role to convene these stakeholders together and to make sure that they effectively bridge those miscommunications and be quite transparent about what are the challenges when you're looking at forging a partnership between the public and private sector.
Can I add 2 words to that?
Please.
Yes, because I completely agree with Moz. The key word here is sustainability for me. In the area that we work, maternal health and family planning, we can always count on private sector. For example, they have corporate responsibility, we have philanthropy group out there, but a sustainable model is a model in which you have 2 principles. There is a win-win situation and there is a business case. One challenge in the partnership that we observe with the private sector is the volume guarantee that is necessary to meet the business case. That's one. Because we can elaborate longer that, but the other is the timeline before we declare an investment a success or a failure. I mentioned a couple of examples at the beginning of this hangout about some investment, and quite often the capital investment is one thing, and that can be easily matched. But the other investment in terms of building capacity in the people, talk about those who will be doing the service delivery, those needs to be picked up either by government or by development organization, and quite often we have some challenges on those ends.
Thank you, Ramil. I think it's a great point, an important point, and clearly a difficult one. How do you demonstrate that this longer-term vision of a stronger health system is returning something on the investment, particularly given that one of the core functions of a health system is to prevent negative things from happening? Where do you draw your evidence base? What's the positive
Michael,
that you can point to?
Michael, can I give a very simple piece of experience that we have at GSK? So about 5 years ago, we agreed a policy of reinvesting 20% of our profit made in the least developed countries back into frontline healthcare worker training and capability building. And so the way we did it was we approached Save the Children, AMREF and CARE and asked them to deliver programs for increasing the number of healthcare workers in the markets we were working. That sounds great. We're giving a percentage of our profits to do this. The way I justify this from a business point of view now is that the profits we make in those markets have gone up. So there's not a direct line between what we've done and I can show you, but the total sustainability of the business has increased. And so every year, actually, since we started that program, we've increased the percentage of profits that have been ploughed back into the healthcare worker program. So when I'm asked to show the benefit of the 20% reinvestment program, we've got all sorts of statistics about the number of healthcare workers that have been trained, the number of lives that have been touched, the number of children's, etc., etc. We also have a very simple statistic, which is the amount, the total quantum we put in every year goes up because the total quantum of profit we make goes up. So for me, this is the classic case of a rising tide lifts all boats. So I give you that as just a concrete example of one of our experiences.